Hello, my name is Stefan Jakob. I'm a German coming from Villingen-Schwenningen in the Schwarzwald, which is the Black Forest. And I'm presenting some data together with my colleagues here, which are named on the poster. A sub-analysis of the Balance 205 study. We all know that obesity is a major problem worldwide because it's, for instance, associated with an increased rate of diabetes development. And we were investigating in this study, in this sub-analysis, people with prediabetes who had been treated with a new component which is called efpeglenatide. It's a long-acting GLP-1 receptor agonist which is injected once weekly or even every other week. And it has been tested in the Balance 205 study, and it has already shown that there is a significant improvement in weight reduction, a significant improvement in waist circumference reduction, and improvement of risk factors. Here in this study, we were looking at this subgroup of people with prediabetes, and prediabetes was defined as having an HbA1c between 5.7 and 6.4 and a fasting glucose between 5.6 and 6.9 millimolar. These people were investigated throughout the study, and we looked whether they were at the end of the study normal glycemic, which is defined as having an HbA1c below all these borders, as I just said, HbA1c below 5.7% and fasting glucose below 5.6 millimolar. When we look at the total group, we have to say that almost 40 to 50% of the people, 140 out of 295 participants, had prediabetes according to the definition. And you see that it is pretty well balanced in each of the group, in the placebo group and in the different treatment arms. Here you see in the Balance study, we were treating the people either with placebo, with efpeglenatide 8 milligrams every other week, efpeglenatide every other week 6 milligrams, or weekly 4 or 6 milligrams. When we look at the different groups here, you see in this table the people who had prediabetes at baseline, and you see that the groups were very well balanced. They had a BMI of 35, they had a HbA1c on average of 5.7, and you see that as you compare the different groups, there's no significant difference. So when we look over here to the figure 4, we see that yes, indeed, when we look at these people, we see compared to placebo, there is a significant and relevant weight reduction after 20 weeks of treatment in all the different groups, either 4, 6 milligrams weekly or bi-weekly, 6 milligrams or 8 milligrams. Associated with that, you see a significant reduction of waist circumference, which was also relevant. Now, most importantly, at figure 2, we see how many people in the different groups reverted to normal glycemia. While in the placebo group, just about 10% reverted to normal glycemia, more than 40% in the efpeglenatide group reverted to normal glycememia. So if you look at the pool data, it was even almost half of the people, which was very successful. Together with that, you see, of course, that there's a significant reduction in HbA1c compared to placebo, and there's also a significant reduction of fasting glucose. Furthermore, when we look at the other risk factors, we see a significant improvement of cholesterol and also, which is not noted here, of blood pressure. So taken together in this subgroup of pre-diabetic patients, we see that a treatment with efpeglenatide, a long-acting GLP-1 receptor agonist, is associated not only with weight reduction, but also with a reversal of pre-diabetes to normal glycemia. And this is also associated with the reduction of cardiometabolic risk factors, thus also supporting the early treatment of these people to reduce the dramatically increased cardiometabolic risk. Needless to say that at the end, if we look at the adverse events, there was no major additional finding except for the known typical risk adverse events, as you would see, and it is specifically the GI disorders which waned off over the time. So if we put this all together, we can say treatment of obese people with prediabetes who had either efpeglenatide in the different doses 4 to 6 to 8 milligrams resulted in significant weight loss, in a significant amount of people reverting to normal glycemia with a well-tolerated safety profile, and furthermore with a reduction of cardiometabolic risk factors. Whether this will also translate in reduced cardiovascular events needs to be shown, but I think this is very encouraging. Thank you very much for your attention.